Protect your community. Do your part. #GetVax, #VaccinesWork. These words formed the central message of the 17th Annual Vaccination Week in the Americas, a week set aside annually at the end of April to promote and celebrate the success and importance of vaccinations globally. Dr. Natalia Largespada-Bear, maternal and child health advisor in the Ministry of Health, told us why vaccines are such a big deal.
The vaccine is just a small, tiny part of a bacteria or a virus, but enough to kick off the immune system, and it allows the child or the adult to build up the antibodies, so when they come in contact with the real virus or the bacteria, they have the capacity to fight off the infection. Vaccines have proven to be very effective. In the last 25 to 30 years, worldwide, we have reduced 99.6% of polio cases, and that is due to the vaccine. But to maintain that goal, we need to continue providing the vaccine, protecting the children against polio, for example.
One particular vaccine-preventable disease that has had much spotlight over the years, especially in recent months, is measles. It is the 5th disease to be eliminated in the region, but in 2017 it resurfaced. According to an epidemiological update from the Pan American Health Organization PAHO, published on May 17, 2019, 12 countries in the Americas have reported confirmed cases of measles, with most of the countries reporting additional cases. Dr. Bear shared with us signs and symptoms of the highly contagious viral disease.
You have fever, you have runny nose, pink eye, cough, and the most significant feature is the rash. And the rash starts 4 days after the fever, and it continues 4 days after the rash starts. And the transmission period now, when one person can pass it to another, unfortunately, it's 4 days before the rash starts and 4 days after, so it's 8 days.
While these symptoms might seem simple, the virus is highly contagious and even potentially deadly to infants. Dr. Bear explained how the virus is spread.
The way how they transmit the virus is through sneezing, coughing, or contaminated surfaces. And the droplets, the virus is in the droplets, and the droplets can be up to 6 feet away from the patient that has measles. And the virus can survive up to 2 hours in those droplets or on contaminated surfaces. That means that any person coming in contact with the droplets with the virus or touching the contaminated surfaces can get infected with measles.
In 2014, there was much hysteria over the Ebola virus outbreak. Though both diseases are of much concern, measles is far more infectious than Ebola due to how easily it spreads from an infected person.
For every person infected with measles, the risk is for 18 other persons to get measles. Compared to Ebola, one person infected with Ebola, 2 persons will be infected with Ebola. So the difference is huge.
The Ministry of Health has established a strong surveillance system and encourages persons exhibiting the symptoms of measles to report it as soon as possible.
We recommend that any person having fever and then develop a rash, irrespective of the cause, they should report it so that we can investigate it. Measles can only be diagnosed by laboratory, meaning we take blood samples and we send it to Trinidad and Tobago, to CARFA, for it to be, for them to do the testing for us. And then simultaneously we run it for other type of infections that we know we have, like dengue, we had chikungunya, Zika. So fever and rash, we're asking persons to report it.
Yearly, the Government of Belize, through the Ministry of Health, procures the measles, mumps, and rubella MMR vaccine, which was introduced in the late 90s. The vaccine is cheap and readily available at both public and private clinics.
We provide the vaccine at all of our health facilities for the ministry, and no out-of-pocket payment is required. It is provided also in private sector, and for those who attend BFLA clinics, they also have, they provide vaccines. If there are communities that want us to go to their community and provide them with the vaccine, we are open to that also. The recommendation currently is, let us make sure every child below 10 years have their vaccines. So it would be great if families can look at their child vaccination card, and if they do not have 2 doses of MMR vaccine, they need to come to us.
One case of measles in Belize, where the disease has been eliminated since 1991, would be considered an outbreak. Dr. Baer says that getting vaccinated will help to preserve Belize's protection.
What we have learned throughout the years is that one should not become complacent with vaccines. Because we don't have any case of polio, we should stop vaccinating. That is not the solution. We have to maintain the protection. If we know that, and we know the vaccine protect, and we are seeing outbreaks in communities elsewhere, in other countries with low vaccination coverage, then the message is there. High vaccination coverage, no measles.
For Belize Now, I am Janelle Mencius.